The danger faced by women going to toilet outdoors in urban and rural India was made clear when two girls were ambushed, gang raped and hanged from a tree in Badaयूं, a small sleepy town of Uttar Pradesh. But defecating in the open is normal for most people living in Indian slums, townships and villages. In India, as per the report on drinking water and sanitation recently presented to Parliament, indicates that 60% of India's population and 70% of women don't have access to a toilet, and these people defecate in the open. According to a report released in Geneva on the progress on drinking water and sanitation in 2014, India continues to be the country with the highest number of people, 597 million people to be precise, that practice open defecation. Which means more people in India practice open defecation than the total population of two continents, North America and Australia, put together. In the heart of India's capital, Delhi, the railway tracks become open toilets for most slum dwellers living in Kachputli colony near Shadipur depot. Women walk out to the shrubs near railway tracks twice a day at the crack of dawn and the onset of dusk. For the ladies living in Sanjay colony in South Delhi, the open space just below the metro railway track, which has a little vegetation, is the only toilet most of them have ever known. They walk out together in groups for safety. After they reach the area, they separate and space out for a little privacy. Savita, aged 45, wakes up her daughter at 5 a.m. every morning so that they can freshen up before the public starts walking in the open spaces where these people defecate. Each takes a bottle of water and they set off for their early morning routine.
We have been living in Sanjay colony for the past 15 to 20 years. We have no facility of proper toilets. We do not have regular water supply. We have to reach in time to get the water from the tanker, otherwise we have to depend on others for water. When we go in the open to ease ourselves, men throw stones at us or harass us. Sometimes the people who own the land also use abusive language and do not permit us to ease ourselves in their land.
Going alone to the toilet is not even an option for women and girls belonging to poor families. It is important to tread carefully during daytime for women as they have to defecate in wide open spaces near the railway tracks. It's literally like an open toilet. And many boys take advantage of the situation to harass women who come here. Women have no option but to bear the humiliation on a regular basis. At times, these women have to shout and rebuke peeping toms if the situation demands to save their modesty. 1 in 3 women in the developing world will be affected by harassment, violence, and in some cases rape as a result of having to leave their homes after dark to find a place to go to the toilet. Darkness gives the women cover and a degree of privacy which is very important to them, but in some ways makes them more vulnerable to drunkards who are always on a lookout for easy prey in the darkness and in excluded places where these women defecate. Women are keen to get the process over as quickly as possible to avoid any kind of confrontation with bad elements. Toilets are not so important for men, but women cannot throw tantrums about having a toilet in the house. Men can go anywhere, anytime. It is only women who need protection and cover. Even in the cities, it is common to see men in India urinating in public against a wall. But women have no choice but to contain any desire to urinate or defecate, if necessary, for hours during a day, as they have no privacy due to lack of toilets. Most times, women have to control their urge, especially at night, due to fear. There is a long wait until the next trip to the open-air toilet, which will be after darkness falls, some 14 or 15 hours later.
At night, if a lady feels the need to ease herself, men have to accompany them so that they are safe while they defecate in the open. Sometimes we have to stay at the open site for 2 or 3 hours if the person's stomach is upset.
The unspoken rule is that the men go to the toilet only at dawn, but boys sometimes break this rule in order to harass or molest members of the opposite sex. The women tell stories of catcalling and groping, though they will never admit that it has happened to them. They say that it only happens to others.
लेडीज के देख के पॉइंट अपना उतार देगा, अपना माने इज्जत पॉइंट सब उतार के अपना करेगा, माने अपना माँ बाप के जैसा।
This humiliating daily routine of using plastic containers to answer a call of nature, staying all night with a soaked sanitary towel, and not having enough privacy to take a simple shower dominates these women's lives. Not only does it place them at risk of health problems like urinary infections, chronic constipation, and psychological stress, but also hinders their full participation in their community's activities.
Most of my patients are women and little children. The major problem that I see in women who come from these slum areas are anemia, malnutrition, worm infestation, living in very poor hygienic conditions which exposes them to diseases like scabies, tuberculosis and more of worm infestation. They are undernourished, they have a lot of children and their basic hygiene is not very good.
Open defecation is a serious public health problem, especially affecting young women and children. It can expose people to diseases such as polio, giardiasis, hepatitis A, and diarrhea. In 2012, nearly a quarter of all young children who died of diarrhea worldwide were Indian. Open defecation is a serious public health problem. A single gram of human feces contains as much as 10 million viruses, 1 million bacteria, 1,000 parasitic cysts, and 100 parasite eggs. Constant exposure to fecal germs can also lead to stunted growth, a condition afflicting almost 61 million Indian children. More than 44 million pregnant women suffer worm infection as a result of poor sanitation every year. A huge number of girls leave their education as they reach puberty, as the shame of having no private place away from their classmates during menstruation is too much to bear. Most of the slum dwellers and villagers face challenges of waste disposal, drainage, and lack of sanitation. The health and hygiene of these people is pathetic due to non-availability of basic amenities like water and sanitation. Even if sanitation facilities are provided, it is out of reach for poor people. The public toilets built by the government or private agencies are poorly constructed and maintained. More importantly, people have to pay 2 rupees each time they use toilets. If women want to use clothes washing facility in these toilets, they need to pay 3 rupees.
We have to pay 2 rupees to use the toilet facilities. If we have to use toilet several times due to bad stomach, we end up paying 20 to 25 rupees, which is exorbitant. How can a poor person afford to pay so much money for using toilet facilities? We have to also feed our children with meager earnings.
Daily humiliation takes a toll on the dignity of poor women who cannot afford a toilet. Often, men hide in the areas where women go to answer nature's call. They humiliate and sexually harass these poor women and girls. In rural areas, incidents of rape and sexual harassment against women is dramatically rising due to the lack of toilet and sanitation facilities. After the Badaun case, many NGOs are coming forward to address this problem. Sulabh International has promised to construct toilets in all the houses of Katra Shahadatganj village of Badaun, where 2 sisters were allegedly gang raped and murdered while they went to relieve themselves in the fields.
Open defecation and manual cleaning of dead cell, both are joined together. Both are the problems India had in the health. The first thing was to invent or develop new technology. Mahatma himself has written that till they clean night soil, nobody will have food with them. To stop defecation open, you need a technology. Because of a sewer system, you cannot solve the problems. So I invented the technology of Sulabh Shauchalaya. It's a 2-pit 4+ compost toilet. In this technology, there are two pits, one used at a time, other kept standby, and when first one is full, switch over to another one. And in the first one, after 2 years, it becomes manual fertilizer. You can use in the field. So this technology is helping, on the one hand, to stop defecation in the open, and also to end the practice of manual cleaning of human feces by the detergents.
The complexity of sanitation beliefs and practices is easy to overlook, especially when census data only counts latrines owned by households, not the behavior of individuals. But mistaking a problem that is partially about access and affordability for a problem that is only about access and affordability, and thereby overlooking the challenges of changing ideas and changing behaviors, will not eliminate the deadly and enduring consequences of this practice. Inadequate sanitation is a major cause of disease worldwide, and improving sanitation can have a significant beneficial impact on health both in households and across communities. Sanitation is the hygienic means of promoting health through prevention of human contact with the hazards of waste. In India, security of women, health and dignity has become a major social concern. If providing basic amenities like water, sanitation and toilet facilities can reduce the threat perception to millions of women, then the government should take steps to provide these facilities.
The fear of Ebola has made the government and social welfare organizations sit up and think about providing better sanitation facilities, as it can lead to the spread of this deadly disease. In India, about 50% family lack toilets. The people who defecate in open may acquire this deadly virus. This virus spreads if the person comes in contact with blood or a bodily fluid of infected animal. Once human infection occurs, the disease may spread among the people as well. Every year, thousands of people die from a preventable disease due to lack of proper sanitation facilities. The government and social welfare organization should build and motivate the people to use toilet to create healthy environment which can check spread of these dreaded ailments. With cameraman Yogesh, I am Jasneet Singh from YMCA.